It's a group of about 50 different organisations across the globe, and what happens is the chief medical officers get together twice a year, and we have a phone call another twice a year to talk about healthcare related matters for those organisations. We chose antimicrobial resistance because it's actually a huge global issue. What's been happening over the past few years is that bugs, bacteria, have become resistant to the antibiotics we have, and new antibiotics haven't been developed. And the reason for that is that it's, for a drug company it costs a lot of money, and actually if you come out with a new antibiotic, the one thing you're going to need to do is only use it when it's needed. So it's that the model doesn't work for some drug companies. So we now find ourselves in the really challenging position that some people can go into hospital with infections and antibiotics don't work. Essentially, it's that we've used a lot of antibiotics, and when you use a lot of antibiotics, those bacteria, they multiply frequently, and in some of when they divide, they mutate, they change ever so slightly, and that's how resistant bugs can occur. So basically, if you use a lot of antibiotics, you're more likely to develop resistant bugs. The pledge or the commitment is that, as a healthcare organisation, we run healthcare businesses. So let's make sure that our hospitals, our clinics, are using the right antibiotics, and they're only using them when they need to be used. So that's the sort of healthcare bit, but then also let's talk to our staff, let's talk to all of us about what to do when you're feeling ill. When is it appropriate to go to the doctors and have an antibiotic? Colds, do you need antibiotics for those? No. So it's about many different levels. It's about our provision business, and it's about helping our staff to understand when antibiotics work and when they're not needed. I think it's important because we have 84,000 staff worldwide. The Chief Medical Officers network now reaches about 8 or 9 million. So the more people we can get involved in this, the more people we can help to understand, and they all have families and they all have friends, you can start to get change. So change will occur from our staff understanding this. And in some countries you've started to see a change in prescribing now. So we are seeing the glimmer of hope in some areas. That's a good question because, there's the sharp end, so the clinical parts of the business. There's also aged care. Aged care facilities, our elderly residents may have infections, and it's important that we treat those appropriately so that our nurses and our carers know when to call doctors and know when is the right time to have antibiotics. In our hospitals we would be looking at formularies. So basically in a hospital you have a list of drugs that you would prescribe, and we make sure that those are the right drugs and that they're unlikely to cause the resistance and that they're prescribed in the right circumstances and also importantly the right length of time. So it's at many levels. So first of all, there's we need to keep working with the doctors and the nurses in our healthcare businesses and in the wider community to make sure that the medical profession and the dental profession are prescribing responsibly. And then it's about everyone else understanding effectively that when they work and when they don't, the limitations of antibiotics, and actually that we need to preserve them because who knows when they're going to need an antibiotic.